From the Action Tab World Headquarters here in Portland, this is T.A. Barnhart for the Tab Report. The healthcare debate gets lost so often in issues of cost that it's easy to lose sight of what really matters: health, healthy people. And it takes much more than providing appropriate services to people to help them stay healthy. Those appropriate services have to be delivered appropriately.
There was an African youth who felt a strong stomach pain and almost lost consciousness. And desperately, his friend called 911 for an ambulance. And then when the ambulance arrived, his friend saw the paramedic coming for him, and he reacted against it, not wanting to enter the ambulance. In his culture, if he had gotten into the ambulance, that meant he was going to die.
This anecdote was part of Senator Lori Monis Anderson's testimony on Senate Bill 97. And it highlights the issue of cultural competency in the delivery of health care in Oregon. The problem, she asserted, is not one of blatant bigotry, but a lack of understanding and a knowledge of cultural issues that vary from the healthcare provider's own cultural norms.
We have a very diverse population, and Oregon's population is continually becoming more diverse. 1 in 3 children under the age of 18 is a person of color. It is very well documented, and there's long-standing research that health inequities exist among our minority population. We need our providers to know that the health inequities exist among these populations. And we need our providers to have the skills to effectively care for patients from these very diverse cultures, languages, groups, and communities. The bill directs the Oregon Health Authority to develop standards for continuing education in cultural competence for licensed healthcare providers. This means all cultures, economic status, race, ethnic backgrounds, disabilities, religion, gender, and sexual orientation.
But is this even necessary?
Colleagues, we overcomplicate things. Quite simply, what we should be telling people is to be nice and pay attention. Be nice and pay attention.
My name is Mitch Purcell, and I'm with the Urban League of Portland. Oregon is becoming increasingly diverse. Communities of color are growing in the state, yet health disparities are really severe amongst communities of color. We have higher rates of diabetes, higher rates of cancer, higher rates of hypertension. Yet the outcomes, the health outcomes, are disproportionately worse than the majority population.
Senator Cruz's simplistic reductionism ignores the real world faced by both non-dominant cultures in Oregon and those attempting to provide quality health care to those populations. This isn't about political correctness, and it's not about more government mandates, as Senator Ferrioli asserted, pulling out that old right-wing fear tactic.
People have reported that currently they don't get the same quality of treatment because of barriers, because of cultural barriers, because of language barriers. And this is a way of developing an expertise within the health provider community to deal with those disparities.
This is a good bill. It will help Oregon's healthcare providers serve all Oregonians. Now it's on to the House, and that is going to be a tough battle. For the Tab Report, this is T.A. Barnhart. Good night.